Basic Hematology in Veterinary Medicine. Hello, and welcome to the very first video in this educational series on veterinary medicine. Today we are going to talk about one of the most fundamental and practical diagnostic tools used in the clinic: hematology. At first glance, it may seem simple, but a routine blood test, known as the complete blood count or CBC, can provide valuable information about an animal's health. It can help diagnose anemia, reveal inflammatory processes, detect systemic infections, or even identify bone marrow disorders. In this video, we will first introduce the main components of hematology, and then discuss what changes in each parameter may indicate in a clinical context. PCV or HCT. The first parameter often evaluated is the packed cell volume, also called Hematocrit. This value represents the percentage of red blood cells within the total blood volume. An increased PCV usually indicates dehydration, or, less commonly, absolute polycythemia. A decreased PCV is a sign of anemia. To further classify anemia, other indices such as mean corpuscular volume, MCV, and mean corpuscular hemoglobin concentration, MCHC, should also be considered. RBC indices. RBC indices are key parameters that help classify different types of anemia. The red blood cell count, or RBC, measures the total number of red blood cells in the blood. Hemoglobin, or HB, indicates the amount of hemoglobin present in the blood, which is responsible for oxygen transport. The PCV, or hematocrit, reflects the proportion of red blood cells relative to total blood volume. Mean corpuscular volume, or MCV, shows the average size of a red blood cell. Mean corpuscular hemoglobin, or MCH, represents the average amount of hemoglobin per red blood cell. Mean corpuscular hemoglobin concentration, or MCHC, reflects the concentration of hemoglobin in a given volume of red blood cells. Red cell distribution width, or RDW, indicates the variation in red blood cell size, also known as anisocytosis. Changes in MCV are clinically important. Increased MCV, or macrocytosis, is often seen in regenerative anemia or in cases of folate or vitamin B12 deficiency. Decreased MCV, or microcytosis, may indicate iron deficiency or chronic disease. Changes in MCHC are also meaningful. A decreased MCHC, known as hypochromia, can be associated with iron deficiency anemia or disorders of hemoglobin synthesis, WBC count. The white blood cell count and differential provide critical insights into the immune and inflammatory status of the animal. The total white blood cell count, or WBC, indicates the overall number of leukocytes. Neutrophils often increase during bacterial infections and may decrease in severe sepsis. Lymphocytes can increase in viral infections or as part of an immune response, and they may decrease due to stress or corticosteroid administration. Monocytes usually increase in chronic inflammation. Eosinophils are commonly elevated in parasitic infections or allergic reactions. Basophils are rare but can be seen during hypersensitivity reactions. Leukocytosis, or an increase in WBC, can occur in inflammation, infection, stress, or even after physical activity. Leukopenia, or a decrease in WBC, is often seen in severe sepsis, bone marrow suppression, or ineffective granulopoiesis. In ruminants, a relatively low WBC count may even be a normal physiological finding. Platelets. Platelets are essential for blood clotting. The platelet count, or PLT, indicates the number of platelets in circulation. Mean platelet volume, or MPV, reflects the average size of platelets, while platelet distribution width, or PDW, shows the variation in platelet size. Thrombocytopenia, or a reduced platelet count, may result from immune-mediated diseases, severe bleeding, disseminated intravascular coagulation, or viral infections such as canine parvovirus. Left shift. One important hematological concept is the left shift, which refers to the presence of immature neutrophils, called band cells, in peripheral blood. A regenerative left shift occurs when immature neutrophils are present alongside an increased total WBC count. This indicates an adequate bone marrow response and generally has a favorable prognosis. In contrast, a degenerative left shift is characterized by a high number of immature neutrophils with a normal or decreased WBC count. This suggests inadequate bone marrow response and is often associated with severe sepsis and poor prognosis. Other key changes. Toxic changes in neutrophils, such as Doula bodies or cytoplasmic basophilia, are seen in severe bacterial infections or sepsis. Lymphopenia, a decrease in lymphocytes, can occur due to stress, corticosteroid use, hyperadrenocorticism, or acute septic infections. Eosinophilia, an increase in eosinophils, is commonly associated with parasitic infections and allergic reactions. Hematology is more than just a list of numbers. It is a mirror of the animal's physiological and pathological state. The true value of a CBC is realized when results are interpreted alongside the patient's history, clinical examination, and other diagnostic findings. No single parameter is diagnostic on its own. Instead, it is the pattern of changes that provides the key to accurate interpretation. This was a comprehensive introduction to basic hematology in veterinary medicine. If you found this content useful, please like the video and subscribe to the channel to follow upcoming lessons. In future episodes, we will explore case-based interpretation and review real clinical examples.